Oh, I know.
Good evening. My name is Perry Hoffman, and I am President and co-founder of the National Education Alliance for Borderline Personality Disorder. It's my pleasure to have you here, and I thank you all for coming and helping to support our effort. I want to particularly thank Rob and Beth Elliott, who have underwritten this event so that all of our proceeds go to support our programs. Tonight you'll hear some information about borderline personality disorder, which often can be a very difficult disorder, and you'll also hear about a lot of hope. You'll hear about hope from an individual who has the disorder, and you'll also hear about hope from family members who are desperate to help their loved ones. It's now my pleasure to introduce Dr. Herb Pardes, who is President and CEO of New York Presbyterian Hospital. Dr. Pardes has been a champion of our cause since our infancy, and he signed on right away to be the chairman of our scientific advisory board, and he's just wonderful because he always says yes to anything that we ask. So we're very appreciative of all that you've done for our effort, and we thank you for being here.
Thank you very much, Perry, and I have to say, you probably all know this, that Perry has been conducting an extraordinary effort over some years to get an enterprise going to pay attention to this disorder. It's selfless, it's genuine, it's dedicated, and she's a wonderful person to lead this effort, and I think we all owe her a real congratulations. Let me say a few words about where I come from and where I necessarily became involved. My field is psychiatry. For years I spent my professional life in the mental health field, and I've been involved in various aspects of it, running hospitals, clinics, conducting a private practice, emergency rooms, virtually all kinds of clinical settings. I also have many friends, and so the problem of borderline personality disorder has become known to me as an individual with friends who've been the victims of that disorder, as well as being somebody in the field trying to help. This is a tough problem, and one of the issues in psychiatry is that many of our problems are elusive, very difficult to get your hands on the basic causes. And yet there's a lot of encouragement from the fact that the research arena in mental health and psychiatry has blossomed enormously. Now, all of that's a backdrop because many other areas got launched. I'll tell you that in 1980, in Madison, Wisconsin, for the first time, a bunch of families got together who had children who were schizophrenic. I was invited at the time. I was the director of the National Institute of Mental Health. So we were interested in mental health conditions of any sort. And when the families said to me, do you think we should start a family citizen movement? I said, absolutely. And I have to say, NAMI, from that first meeting, developed into one of the most potent forces with regard to policy in Washington. And I think they've got several 100,000 members, a large staff, and they're constant advocates for good treatment, better attention to people with psychiatric illnesses, particularly schizophrenia, and also have been big advocates of research. And then after that, I saw over the years a group called NARSED form, which was put together by a group in Kentucky, and also NAMI and the Lieber family, who you may or may not know, who have a daughter who is schizophrenic, became leaders and have been very successful in trying to build a large research enterprise. And there was an anxiety disorders group. And then there was the manic depressive group, which at one point was based only in Chicago and then became national. Now, why do I say all that? It's to make the point in the following way. When people got together and decided that they were going to take on the issue, they built entities of consequence. They had influence, they've had an impact on what NIMH does, They have an influence on policy, and frankly, that's the only way you can do it. You've got to get a large number of people who count, who can get to the political arena. I can't tell you one story, because I've had a lot of kind of interesting experiences in the mental health advocacy field. Years ago, and I don't know if anybody would remember, there was a congressman named Joe Early from Massachusetts. And Joe was a wonderful guy who cared a lot about the National Institute of Health. And I went one day with the mother of a schizophrenic child, and I, as the director, was trying to convince Joe to put more money in the mental health research budget. And so I spoke to him for a while, and he listened patiently. He said to me with a nice, healthy accent, "Doc, tell me what the new breakthroughs are." And I tried to tell him whatever I could. And then he turned to the mother, and he said, "Tell me what you've been experiencing." And she talked for a few minutes about her experience with her child. And he turned to his aide after she had finished. She said, "Get him the money." And that, to me, speaks for itself. A combination of citizen advocates who feel the pain and professionals who know something about the mental health field going together to influential people in the legislature, in Congress, in the administration, will be an important way of seeing some real progress. What's needed is an adequate representative of people in the NIMH, that's the major funder of mental health programs, along with SAMHSA to some degree as well. But to get to the federal agencies who care about this, who can do something about it, and you've got to show that you have some political force, people who care, a number of people who are going to support it, and that's the way things get moved. So today, by contrast to, let's say, the 70s when I was at the NIMH, there are a number of different citizen organizations which have blossomed and are trying to make the fight for attention to the particular mental health disorders that are of concern to them. I'm not pretending that there isn't a long way to go. We're far from good answers in terms of how to address many of the psychiatric problems, but it's a long way from where we were 20 years ago. So I will simply say that to whatever extent I can be helpful, and my colleagues, I know you've got a very distinguished group of people in the healthcare field on your advisory council. We're happy to help. It's wonderful to see so many faces here, and I think the problem merits it. So I look forward to seeing Perry, with your help and all of our help, making this more and more an issue on the radar screen of people who count in the country, and as a result, seeing if we can get some better answers as to how to tackle it. So thank you for having me here, and Perry, good luck, and I give it back to you.
Thank you so much, Dr. Pardes, and I know that you have to leave for an 8.